What if the blood pressure number your doctor told you to aim for is actually wrong for your age? I know that sounds alarming, but stay with me for the next few minutes, because what I'm about to share with you could be one of the most important things you hear this year. Not because I'm selling you anything, not because I want you to buy a supplement or a device. Everything I'm going to talk about today you already have access to. The information is out there, but almost nobody is putting it together in a way that actually makes sense for people over 60. So if you're an older adult, or if you love someone who is, and you're managing blood pressure, or you've been told your numbers are a little high, or you're on medication and still feeling exhausted and dizzy, this video is for you. Because the truth about blood pressure in older adults is more complicated and more hopeful than most people realize. Let's get into it. The problem nobody is talking about. Here's a number that should stop you cold. Nearly 70% of adults over the age of 65 in the United States have high blood pressure. 70%. That means if you're sitting in a room with 3 of your friends your age, chances are 2 of you are dealing with this right now. And yet, and this is the part that frustrates me deeply, most of those people have never been told that the blood pressure targets used for younger adults may not be the right targets for them. For decades, the standard goal was simple. Get your blood pressure below 120/80. Clean, simple, easy to remember. Doctors wrote it on prescription pads, nurses repeated it at every checkup, and patients built their entire health anxiety around that number. But here's the point almost no one talks about. Your blood vessels at 70 are not the same as your blood vessels at 40. Your kidneys are not the same. Your brain's ability to regulate blood flow is not the same. And treating a 72-year-old body like a 42-year-old body when it comes to blood pressure can actually cause more harm than good. I want you to really feel that for a second. The very treatment meant to protect you could, if applied incorrectly, be putting you at risk. We're talking about falls, dizziness, fainting, kidney damage, even cognitive decline. Now, I'm not here to scare you. I'm here to give you the real truth, the kind of nuanced, evidence-based understanding that you deserve to walk into your doctor's office with, because an informed patient is a protected patient. Stay with me until the end, because I'm going to walk you through exactly what the research says, what the right target ranges look like by age, what mistakes are silently harming older adults every single day, and 2 real stories of people who turned things around once they understood this. The Science Foundation. Why blood pressure changes with age. Let's talk about what's actually happening inside your body, and I promise I'm going to make this simple. Think of your circulatory system like a garden hose connected to a water pump. When you're young, that hose is flexible, elastic, soft. The pump pushes water, the hose stretches a little to absorb the pressure, and everything flows smoothly. Now imagine that over 60, 70 years that hose gets a little stiffer, less flexible. Maybe there's some mineral buildup inside. The pump, your heart, now has to work harder to push blood through. That's essentially what happens to your arteries as you age. A condition called arterial stiffness is almost universal in older adults. And here's the critical thing. When your arteries are stiffer, your systolic pressure, that's the top number, naturally rises. Your body is actually compensating. It's not broken. It's adapting. Now here's where the danger begins. If a doctor looks at that higher systolic number and aggressively medicates it down to what's normal for a younger person, what can happen? The blood pressure drops too low. And in an older adult, blood pressure that's too low means the brain isn't getting enough blood flow. That leads to dizziness, lightheadedness, falls. And falls, for adults over 65, are one of the leading causes of serious injury and death in the world. A landmark study, the SPRINT trial, showed that intensive blood pressure lowering in older adults did reduce cardiovascular events, but it also showed increased risk of acute kidney injury, fainting, and electrolyte abnormalities. The benefit was real, but so was the risk. And the key was in the individualization, not a one-size-fits-all number. Show graphic. Systolic versus diastolic explained simply. The American College of Cardiology and the American Heart Association updated their guidelines and acknowledged something powerful. For adults over 65 who are otherwise healthy, a target of under 130 systolic may be appropriate. But for adults over 80, or for those who are frail, have multiple conditions, or take many medications, a more relaxed target, around 140 to 150 systolic, may actually be safer and healthier. This is not weakness in medicine. This is wisdom. And yet millions of older adults are still being chased to numbers that their bodies simply cannot safely sustain. The mistake that's silently harming older adults. Let me tell you about Margaret. Margaret is 74 years old, retired school teacher, lives in Ohio. She came to her doctor's office 2 years ago. Blood pressure reading was 148/88. Her doctor, following standard protocol, put her on a calcium channel blocker and told her the goal was to get under 120. Margaret trusted her doctor completely. She followed the plan. Within 3 months, Margaret's blood pressure was down to 118/72. Her doctor was pleased, but Margaret was miserable. She felt dizzy every time she stood up from a chair. She stopped going for her morning walks because she was afraid of falling. She started avoiding social events because she felt weak and foggy. Her daughter noticed she seemed off, slower, quieter, less like herself. What was happening? Margaret's brain had adapted over decades to slightly higher blood pressure to maintain adequate blood flow. When that pressure dropped too fast, too low, her brain was essentially being underperfused. She wasn't getting enough circulation to her most vital organ. She wasn't sick because of her blood pressure. She was getting sick because of the treatment. It wasn't until Margaret found a geriatric specialist who reevaluated her full picture, her age, her frailty index, her medication list, her functional ability, that her target was adjusted to under 140. Within 6 weeks, the dizziness eased. She started walking again. She went back to her book club. Same woman, same diagnosis, different number, completely different life. Now let me tell you about Raymond. Raymond is 68, former construction worker, lives in Texas. Big guy, active, still mows his own lawn, plays with his grandkids on weekends. His blood pressure was hovering around 155/95. His previous doctor had told him, "It's just a little high for your age, don't worry about it." But Raymond started getting headaches, not crippling, just persistent, and he noticed he'd get short of breath climbing stairs, something that never used to bother him. Raymond's new cardiologist took a different approach. Instead of immediately loading him up on medication, she did a full cardiovascular risk assessment. She looked at his cholesterol, his kidney function, whether he had any signs of target organ damage. And yes, Raymond needed treatment. But the treatment was thoughtful, a low-dose ACE inhibitor combined with lifestyle adjustments. More importantly, she explained to Raymond what his goal was and why. A target of 130 systolic was appropriate for him. He was relatively healthy, functionally strong, and his cardiovascular risk profile justified the more intensive approach. Raymond didn't feel dizzy. He didn't feel foggy. He started walking 30 minutes a day. 8 months later, his blood pressure was 128/81. His headaches were gone. He ran after his 4-year-old granddaughter at her birthday party. 2 people. Similar age, different bodies. Different targets, and both of them are better off because someone stopped applying a universal number to a very individual life. Back to our topic, because this brings us to the most important part. The golden truth. What is the best blood pressure for older adults? Now I'm going to tell you the right way to think about blood pressure as an older adult, and I want you to write this down, or better yet, save this video, because this framework is something you can bring to your very next appointment. Golden moment. Number 1, it's not one number. It's a range based on your age, health, and function. For adults aged 65 to 79 who are relatively healthy and not frail, the current evidence supports a systolic target of under 130 mm Mh, but only if it's achieved safely, without causing dizziness, falls, or kidney stress. For adults aged 80 and older, or those who are frail or have multiple chronic conditions, a systolic target of 140 to 150 mmHg is increasingly recognized as appropriate and protective. Trying to go lower may cause more harm than good. For the diastolic number and the bottom number, going too low, below 60 to 65 in older adults, is now understood to be potentially dangerous, increasing risk of heart attack in people with existing coronary artery disease. This is called the J-curve effect. Your heart fills with blood during diastole. If the pressure is too low, the heart doesn't fill well. Period. Show graphic. Age-based BP target ranges. Golden moment number 2. How you feel matters as much as the number on the screen. If you're hitting your target number but feeling dizzy every time you stand up, that is not a success. That is a warning. Tell your doctor. Don't just accept it as a side effect of aging. It may mean your target needs adjustment. Golden moment number 3, home monitoring changes everything. White coat hypertension, where your blood pressure spikes at the doctor's office due to anxiety, affects an estimated 15 to 30% of patients. That means millions of people may be medicated based on inaccurate readings. A simple home blood pressure monitor used correctly gives your doctor far more useful data than a single office reading. Here's how to use it right. Sit quietly for 5 minutes first. No coffee in the last 30 minutes. Feet flat on the floor, arm at heart level. Take 2 readings 1 minute apart. Record both. Do this at the same time every day. Morning before medication is ideal. That data tracked over 2 to 4 weeks is worth more than any single clinical reading. Golden moment number 4, the lifestyle changes that work for older adults specifically. I'm not going to tell you to run a marathon. I'm going to tell you what the research actually supports for people over 65. Sodium reduction is real and powerful. Older kidneys are less efficient at excreting sodium, which means salt has a bigger blood pressure impact in older adults than in younger ones. Reducing sodium intake by even 1,000 milligrams per day, that's roughly half a teaspoon of salt, can lower systolic pressure by 5 to 6 points on average. The DASH diet, which emphasizes fruits, vegetables, whole grains, and low-fat dairy, has been shown in multiple trials to reduce systolic pressure by 8 to 14 points. That's comparable to some medications, without a single pill. Moderate physical activity, even 30 minutes of brisk walking 5 times a week, has been shown to lower blood pressure by 4 to 9 millimeters of mercury. And for older adults, resistance training, not heavy lifting but body weight exercises or light weights, also has measurable benefit. Alcohol reduction matters more than people think. More than 1 to 2 drinks per day raises blood pressure meaningfully, especially in older adults. And sleep. Poor sleep, less than 6 hours, or disrupted by sleep apnea, drives blood pressure up significantly. If you snore, if you wake up feeling exhausted, please ask your doctor about a sleep study. Treating sleep apnea alone can reduce blood pressure substantially. These are not small things. These are powerful, evidence-based levers that your doctor may not have had time to walk you through, but they are real, and they are yours to use. Warnings, enemies, and how to protect yourself. Now let me warn you about the 3 biggest enemies of blood pressure control in older adults, because knowing these could save you from a very preventable crisis. Enemy number 1, medication overload without reevaluation. Many older adults are on blood pressure medications that were prescribed years or even decades ago, and nobody has stopped to ask whether those medications and doses still make sense for the person they are today. Bodies change, weight changes, kidney function changes. A medication that was perfect at 58 may be too aggressive at 75. If you haven't had a full medication review in the last year, ask for one. It is your right as a patient. Enemy number 2, NSAIDs, the hidden blood pressure saboteurs, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen. These are some of the most commonly used over-the-counter medications in the world. And they significantly raise blood pressure, especially in older adults, by causing sodium and water retention and reducing the effectiveness of blood pressure medications. If you're on blood pressure treatment and regularly taking ibuprofen for joint pain or headaches, you may be fighting a losing battle without knowing why. Talk to your doctor about alternatives. Acetaminophen, Tylenol, is generally safer for blood pressure when used appropriately. Enemy number 3, orthostatic hypotension, the silent fall waiting to happen. This is when your blood pressure drops sharply when you stand up from sitting or lying down. It's extremely common in older adults on blood pressure medication, and it's responsible for an enormous number of falls, hip fractures, and hospitalizations. The fix is often simple. Rise slowly. Sit on the edge of the bed for 30 seconds before standing. Make sure you're well hydrated. And tell your doctor if you feel lightheaded when standing, because that symptom alone may indicate your medication needs adjustment. These 3 enemies are real, and now that you know them, you can protect yourself and the people you love. The emotional close. I want to say something directly to you because I think you need to hear it. Getting older does not mean surrendering your health to a number on a machine. It does not mean accepting dizziness, fatigue, and confusion as your new normal. And it does not mean blindly following a target that was designed for a different body at a different time in life. You deserve personalized care. You deserve a doctor who looks at you, not just your chart. You deserve to know what your goals are, why they exist, and what it's going to feel like to get there safely. The best blood pressure for an older adult is not 120/80 by default. It is the number at which you feel well, function fully, and are protected from both the damage of high pressure and the danger of pressure that's too low. That's the real truth, and now you know it. Pause ones. If this video helped you or someone you love, I want to ask you a genuine favor, not for me, but for them. Share this video with an older adult in your life, a parent, a grandparent, a friend, because this information could prevent a fall, stop an unnecessary medication, or start a conversation with a doctor that changes someone's life. Like this video if you found it valuable. Subscribe if you want more honest, evidence-based health content that actually respects your intelligence. And leave me a comment right now. What's your current blood pressure target? And has your doctor ever explained why? I read every single comment, and your story might help someone else who's going through the same thing. And coming up next, I'm going to show you the 5 foods that cardiologists say have the biggest impact on blood pressure in adults over 60. It's not what most people expect. Don't miss it. Take care of yourself. You're worth it.